So there is this group of people, and I'm one of them, who think that the autoimmune hypothesis may not be correct. So in other words, the inflammatory reaction that happens in MS may be secondary to a viral infection, for example. And so what causes this disease is initial targeting of the oligodendrocyte, and then you get the second inflammatory cascade that triggers the focal lesion and the damage. And so the way to treat that disease then would be to prevent the viral infection or treat the virus is up front. Two viruses two class of viruses, I already mentioned to you Epstein-Barr virus. I personally think it's causal. So if we stop people getting Epstein-Barr virus, we'll stop people getting MS. And that's one of the hypotheses that's been progressed by a vaccine trial. We hope when an EBV vaccine does emerge, by doing an EBV vaccine trial in high-risk people, we may be able to reduce their risk of getting the disease. But another group of viruses are the human endogenous retroviruses, and they've been associated with driving MS disease activity. And there are some treatment strategies that are emerging to treat human endogenous retroviruses. Either they're biologically active products. So there's a company in Switzerland that's made a monoclonal antibody that targets the envelope protein. And we know that this protein is biologically active. It's actually a toll-like receptor 4 agonist. So it may act as a stimulant to upregulate inflammation. In other words, lower the threshold for triggering autoimmune reactions. So that's currently being explored as a treatment trial. Others are, including me, are trying to get highly active endogenous retroviral drugs into MS to see if we suppress the activation or transactivation of human endogenous retrovirus, and we maybe prevent that cascade. So there are people working on alternative hypotheses. There's a company in the United States is now looking at cytotoxic T lymphocyte cell lines that target Epstein-Barr virus as a treatment. And I'm aware that there's a group of investigators that are trying to get CAR T cells, engineered T cells, that target EBV or B cells that are infected with EBV as a treatment target in MS. So we're beginning to see the alternative or viral hypothesis being explored further as a strategy in MS. To conclude then, I just want to say that multiple sclerosis is a global problem. There's an epidemic. An epidemic is an increasing incidence and prevalence of this disease worldwide, and we're seeing some areas of the world going from a low incidence, low prevalent environment to a high incidence, high prevalent environment. The one example is Iran. Within 30 years, it's gone from having a prevalence rate of 6 to 10 per 100,000 to well over 90 per 100,000, with a male to female ratio, 1 male to 5 females. So something's happening in these hotspots that's triggering multiple sclerosis. It's a disease of young people. It's a disabling disease, so it stops people working. So the socioeconomic impact of this disease is extremely high. The good news is we can diagnose the condition very well nowadays and a lot earlier, and we have very effective therapies, so we should be able to improve the outcome of this disease long term. We also have a lot more understanding about the biology of this disease, both in terms of causation and the immunology, and the downstream impact of this disease. For example, the neurodegenerative phase, demyelination, and mechanisms to try and restore function. So it's an exciting time to be in this field of multiple sclerosis with a lot still to do.